Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Kishore KV. He is a highly accomplished neurologist and epileptologist currently practicing in Bengaluru. He has had a brilliant academic career and got gold medal, and he was trained in the prestigious NIMHANS, and later on he got his MRCP from UK, and after the post graduation he did the postdoctorate fellowship again in NIMHANS. And today he has got a very popular spike and wave special media to educate the people. And today he has come to our show to explain to the people what this epilepsy is and how it has to be done. And today he is going to tell us about the treatment aspect of it. Welcome, Dr. Kishore.
Thank you. Thank you, ma'am.
See, many a times, parents, the patients, as well as the public, they won't know it is fits. They may think that somebody has fallen unconscious, it is just fainting. Or somebody may think that, there is something terribly wrong, and then they may mistake for something else. And they may think that because he has fallen, it has happened. So please tell us how this epilepsy occurs. What are the types of epilepsy? Like how to detect them.
Yeah. So it is an interesting thing to know how public gets knowledge about this epilepsy. It is through films and serials where
Which
an
is
actor.
always it is wrong only. Because we have seen the doctor comes and feels the pulse and he says that she's pregnant. Like that, the epilepsy also they will demonstrate in a wrong way. Yeah.
Yes. So nobody has seen how real epilepsy patients will behave. Some because actor will enact whatever the director or somebody shows, and they also may not have seen. And even if they have seen, they may not have seen completely. Usually, what happens is they would have seen towards the end where they are violently beating the hands and legs. There is jerking movement. So same thing has been communicated to the actors, and it is perpetuated eventually to the general public. So generally what happens is, from where the abnormal electrical activity starts, based on that symptoms can vary person to person. For example, it can be gingin in the hand if it is starts in the hand area. It can be loss of vision if it starts in the occipital processing area, vision processing area. And it can be fearfulness, or it can be throat constriction based on different areas. Giddiness is a very common thing. So based on where it starts and where it moves, symptoms can vary accordingly. So
and also blackout can occur, suddenly blackouts, and then they are not aware of it, and then they come back to the
yes,
consciousness.
yes, exactly. This is in children we see very common. So we call it as sometimes absent seizures. So where they become like a statue for few seconds and then they become normal. They are not aware. So it is how we detect is we ask the parents to get their notebook in the class if they are dictated, or if they are writing down something. So there will be lot of gaps. Over a few months when we check, there can be many gaps, and we'll be able to ascertain by that. It is one of the clues. Not that every time there is a gap we should be worried. It is just a clue. If it is a consistent, we need to be little careful in evaluating.
Yes. Okay. And what is this epileptic cry and what are the epileptic aura? How should the patients or the relatives or the parents should realize?
Yeah. So usually, for generalized epilepsy, no, they because the electrical activity communicates very quickly across the brain regions, so there won't be enough time. So they lose consciousness suddenly. There will be epileptic cry because all the muscles are tightened, and even the respiratory muscles are
And
contracted
even the
because of
vocal
that.
cords will go into spasm. Yes.
Yes, yes. Because of that, there will be an epileptic cry, and there will be jerking movements of hands and legs. So when it comes to focal seizures, that means if it is starting in one place and going to other region relatively slow. Of course, in brain everything is fast, relatively slow. So there will be enough time. Sometimes they get symptoms like raising epigastric sensation, visual auras, or some paresthesias of the hand or weakness of the hand. So they will be able to sense themselves if they start getting many times and they take care of themselves. They go and sit sometimes, and they tell others. Especially in children, what we have noticed is they run toward their parents or caregivers and hug them because they know
Yeah.
something is going to happen. So this is one of the clues called as
Okay.
epileptic aura.
Okay. And now, everybody knows what is ECG, because every time a celebrity dies, they will be queue for the ECG. And when there is any pain, even muscular pain, they will go and get the ECG. But what is this EEG? And when do you do, and how do you interpret, and what is the use?
Yes. So ECG is to pick up the electrical activity of the heart. EEG, electroencephalogram, is to pick up the electrical activity of the brain. So basically, as we discussed in the past episode, seizures are like earthquakes. So the bigger earthquake you and I can feel, the smaller earthquakes I can be able to means the bigger seizures everybody can pick up. The smaller ones many a times I can pick up, not the general public. Even smaller ones, even I will not be able to pick up. Same way, so we use EEG to pick up these smaller seizures or small subclinical electrical abnormality. So that is
Okay.
how EEG is used. But most of the times, EEG may come normal. Why? Because we only record for 30 to 45 minutes. So I cannot
Okay.
vouch for what has happened before 1 minute and after
In
one
the
minute
past
also.
or in the future.
Correct,
Whereas
correct.
in the ECG, if there was a heart attack in the past, that we can see the changes, but we cannot predict the future.
Future.
Yeah, so here you can't make out the past as well as the future. Okay.
Yes, yes, yes. Most of the times, but
Okay.
few of the times we are able to pick up some abnormality based on if there is a scar, some slowing, and all those things is there. But most of the times we are not able to tell the past.
Okay, okay, okay. Now, once the EEG is not possible, what are the other investigations to detect where the scar is, where is the epicenter? Like, for the earthquake, you have a center. In the same way, in the brain, how do you detect where exactly is the center from where these activities are coming?
Yeah, for that, what we will do is we will do a video EEG where
Hmm,
video recording is continuously there. Along
hmm,
with that, high means we use more electrodes
hmm,
across the scalp to
hmm,
pick up
hmm,
from where the electrical abnormality comes, and
hmm,
we see and we know from, for example, during seizures
hmm,
everything happens for a reason, in the sense
hmm,
every eye twitch, every mouth twitch or anything has a meaning. So we
hmm,
analyze the clinical semiology,
hmm,
we see the EEG and
hmm,
try to correlate from where it has started, from where
hmm.
it has gone, like a how river flows. We try to
Okay.
map the electrical flow. That's how
Okay, okay.
we'll be able to identify the epicenter.
Epicenter. Okay, now that you have got, there are two methods. One is the non-surgical treatment, that is with the medicines. Other one is the intervention or the surgical. Now, coming to the drugs, should they take lifelong or it is for time being, and what exactly is it, and how safe are these drugs? Because I have seen a young lady taking these drugs for epilepsy, and when she conceived, she had a baby with a congenital heart disease. So we always ask them to stop or consult the neurologist. How do you guide them?
Yeah. So coming to now, should we take medicine after if somebody has a seizure? See, for example, if it is the first seizure, MRI is normal, EG is normal, we will sit across the table and discuss the risk and benefit. See, it is the first time, we don't know whether it will repeat or not. There is an option to not to take medications and wait and watch. but they have to be on a safer side. But if this is for seizures. But if it is coming again and again, then the risk is too high. You have to take medications.
Yes.
So the duration varies for few people, few years, for few people more, and then we'll based on if they are okay, no seizures, no recurrence, then we slowly reduce and stop also. Coming to the newer medications which we have now is safer for women in childbearing age. So for any woman with childbearing age, irrespective, so we start them on a safer medicine. And we always prefer one medicines. So if by chance seizures are not controlled, we use second medicine also, which is relatively safer for women in childbearing age.
Okay, okay. So now you have the safer drugs, and even the young women, they can come and tell you and take the counseling and change the drugs also, you said. Now, what about the surgery or the intervention, like how we have in the heart, if there is an arrhythmia, we just do the mapping and electroablation is done. How do you do in the brain? Because brain cells, it's very important. Even if the few cells are damaged, they can have the residual neurological deficit. So how do you do it?
Correct. So what we try to do is we try to look where are the epicenter of this epilepsy. Where are the seizures arising from? With video EG, we do high resolution MRI, PET scanning of the brain, neuropsychological assessment, MEG, and SPECT. Many things are there. We try to get information as much as possible. If we are able to find out one region from where all the seizures are coming from, and if they are in the safe area of the brain. See, all the area of the brain is important, obviously. If they are in a safe processing area of the brain, which can be surgically removed, and then we will suggest them for surgery. Because only with surgery, definitive cure can be considered.
Okay.
In case,
What about the
if we have
ablation?
in case we have multiple areas of seizures coming, so we cannot remove multiple areas. So that time what we go for, uh, other options are there, in the sense we call it as VNS, vagal nerve stimulation, and we also has sometimes in rare cases DBS for epilepsy is also coming up. And these are the other modalities where surgical cure is not possible.
So ultimately, what advice or the piece of suggestion that you would like to give it to the audience, so that when they see a person and how to detect and what the parents have to do, the do's and the don'ts, please.
Yeah. So epilepsy is manageable. For many of them, it can be managed much, 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 much better, because 70 to 80% of them is managed by only one medicine.
And
Okay.
normal life they can lead.
Yes, whatever they are destined to, they will achieve just with one medicine. For few people, yes, they may need second medicine, third medicine, and all, and they may require this pre-surgical evaluation and all those things. But by and large, they are equal, they are same, they can do everything as means normal general population.
Okay. So thank you very much, Dr. Kishore, for giving such valuable knowledge and advice to our viewers. Thank you.
Thank you. Thank you.